So here we will be studying about the cardiovascular system. Cardio simply refers to the heart and vascular refers to the blood vessels. So in this system, now in this video we will be studying about the relation between the heart and the blood vessels and its functioning. We will be seeing about the basic terminologies in this video. Further we will go for its what are the processes there. So now first we will be seeing about acute coronary syndrome. Acute here simply refers to for the small duration and coronary syndrome. It refers to rupture of an atheromatous plaque in a diseased coronary artery which rapidly form an obstructive thrombus. So atheroma is a medical term for the buildup of materials that adhere to arteries. Among others, these include fat cholesterol. So the accumulation of cholesterol in the coronary arteries which lead to a disease condition known as acute coronary syndrome. Now we will see for the second term, that is afterload, the amount of resistance to ejection of blood from the ventricles. Whatever the blood is moving out from the ventricle is known as afterload. And the apical impulse is nothing but the impulse normally palpated at the fifth intercostal space, left mid clavicle line, caused by the contraction of left ventricle. And this is the contraction of the left ventricle is caused by that is known as apical impulse. I hope this slide is clear for you. For the next one is atrioventricular node. We simply call it as AV node. So this node is present between the atrium and the ventricle. So it is known as atrioventricular node. It is the secondary pacemaker of the heart, located at the right atrial wall near the tricuspid wall. So this we have to keep it in the mind that the right side of the heart consists of tricuspid wall, which also consists of atrioventricular node. So in this I have given a small diagram for you to refer it. I hope it's very clear for you. If you want further understanding, you can pause and see the parts of the heart. The next one is baroreceptors. These are the nerve fibers located in the aortic arc and the carotid arteries that are responsible for the control of blood pressure. Simply, what does it mean by blood pressure is the pressure applied on the arteries of the wall is known as through the blood is known as blood pressure. So simply the pressure applied by the RBCs, red blood cells, on the arteries of the walls of the arteries is known as blood pressure. Next one is cardiac catheterization. It is the invasive procedure used to measure cardiac chamber pressures and assess the patency of the coronary arteries. So how much it is applying, or how much the arteries are applying the pressure. It is known as what is the procedure to know how much pressure it is applying and to assess the patency, how much it can function properly or not. That one is known as cardiac catheterization. Next one is cardiac conduction system. It is specialized heart cells strategically located throughout the heart that are responsible for methodically generating and coordinating the transmission of electrical impulse to the myocardial cell. I hope it's clear. The next one is cardiac output, amount of blood pumped by each ventricle in liters per minute. So this one is nothing but cardiac output. Next one is cardiac stress test, a test used to elevate the functioning of the heart during a period of increased oxygen demand. Test may be initiated by exercise and medications. So whenever we do exercises, our heart rate increases, which in turn shows the oxygen demand is being increased. So hence we can go for cardiac stress test. The next one is contractility, ability of the cardiac muscle to shorten in response to an electrical impulse, that is known as contractility. Next one is the depolarisation, electrical activation of a cell caused by influx of sodium into the cell while potassium exists in the cell. So in a cell, it consists of, previously it is consisting of potassium. Along with the potassium, sodium is being activated, through which electrical impulse is been generating. So that one is known as depolarisation. And the next one is diastole. Diastole is nothing but the period of ventricular relaxation resulting ventricular filling. So whenever the ventricles are being filled, okay, that one and it is relaxing, ventricular relaxation, that is known as diastole. The next one is ejection fraction, percentage of the end diastolic blood volume ejected from the ventricle with each heartbeat. It's clear. Hemodynamic monitoring. Hemo refers to the blood, dynamic monitoring. Use of pressure monitoring devices to directly measure cardiovascular function is known as hemodynamic monitoring. The next one is hypertension, blood pressure that is persistently greater than 150/90 mm of G. So the normal blood pressure is 120 by 80 mm. So the more is the volume, that is 140 by 90 mm is leads to hypertension. The next one is hypotension. A decrease in blood pressure to less than 100 to 60 mm per Hg, that is known as hypotension. Whenever it is less than 120 by 80 mm, it leads to hypotension. Next one is murmurs. Sounds created by abnormal turbulent flow of blood in the heart leads to murmurs sound. Okay. The next one is myocardial ischemia, condition in which heart muscle cells receives less oxygen than needed. How much the oxygen demand is there, less oxygen it is supplying to the heart, that leads to myocardial ischemia. It is a type of disorder. Myocardium is the muscle layer of the heart responsible for pumping action of the heart. Alright. Now last one is normal heart sounds. The mainly two types of heart sounds can be heard, that are S1 and S2. S1 is the atrioventricular valves and the S2 is semilunar valves. So I hope it's clear. Now we will also be seeing part 2. If further we will see part 3 also. So I hope it's clear. Do comment in a comment box and give a like button, share, and also subscribe to our channel. Thank you.